people during the pandemic had to go out to work every day because they were considered essential workers. But for that, that meant they were going to work construction or work in a factory.
Right.
And it was factories and meatpacking plants and fish houses,
Right.
um, where people work closely together. That's where the disease got spread.
Of course, and think about it. These people don't have the luxury of a savings, account backing them up. They're living paycheck to paycheck, and they're going to drag their asses to work no matter what condition they're in.
Because they got, particularly if they're undocumented, they kind of have no choice. They're
They have
always
no choice,
on
of
the run a
course.
little bit. And it's like there were lots of people who are in better circumstances who could work from home or, lived in a 5-bedroom house and there were 3 people living there so they could spread out, not in Central Falls. Almost like 10% of the population could work from home.
Right.
So,
Right.
like they were a setup. The population of Central Falls were a setup for this kind of spread of disease. And this whole process where, their wealth is extracted, they don't have much wealth.
Yeah.
And so when what they've got is removed, they just don't have much left.
Right. Right. And, not to mention the fact that, the mortality rate of people that were obese and people that kind of fit the demographic of these poorer communities because they're eating whatever food they can afford to buy. And unfortunately, the most readily available food supply is highly, processed crap that, that kind of fuels the fire of their disease and diabetes and obesity, et
And
cetera. Stress,
stress
right?
itself, right?
And these are the
Living
folks
close to a factory, et
that
cetera.
were really impacted by COVID. What did you see on the front lines of this thing? Were a lot of these people dying?
Well, I can talk about the statistics in a minute.
Yeah.
We knew that the disease was in Central Falls because, in some of the work we had done together, we had developed a close relationship with EMS.
Mm,
And I found, I carried the title of the chief health strategist for the city of Central Falls.
yeah.
And I was working closely with EMS and folks from EMS in March of 2020 said, we've seen 4 or 5 deaths of young people who we found dead in their houses.
Oh,
And then when we took them to the hospital, then they tested them and found out it was COVID.
wow.
So that's how we learned about it. There were too many young people who died. We did a bunch of things to intervene to try to stop that. And that volunteer process was one of those things. So
Mhm.
we ended up with a crude death rate that was about average for the state. But I think about average in the most infected place in the state, nation, in the world. I think about an average death rate was a huge success.
Yeah. Oh, sure. No question about it. It was absolutely devastating. It was the darkest period that I can remember being alive. I'm 58 years old now, been around for a while, and I don't remember ever there was the Vietnam War. I was a kid, didn't really impact me. There were some wars here and there. Didn't go through World War II, didn't go through a plague, that sort of thing. But COVID was a really dark time in this country, at least from my perspective. And it seems that an awful lot. Look, we responded and we got out of it, thank God. But it seems to me that there's definitely some level of manipulation and profiteering that is it's really disgusting that you know if for folks to have profited um off of COVID the way that they did, it's it just talk about angry, it really is infuriating.
For folks to profit off healthcare is
Correct.
just, I mean, that, the profiting in COVID when we had a national emergency was
Yeah.
particularly painful. But I
Mm,
grew up with an ethic that said, you shall not profit off someone else's misfortune.
mm,
Um, that is a major societal, uh, you know, sort of a major societal ethic, because once people start profiting off each other's misfortune, then there's actually an incentive to cause that misfortune.
Mm,
And then we create a society at war with itself. And
yeah.
that's the thing that we must not do, and yet we're doing every day. And I wonder about the extent to which that ethos has pervaded the society and caused some of the perception of partisanship and rancor, because we've decided that it's important. I mean, that it's okay for people to profit off one another's hardship.
Yeah, no doubt. And look, and this is not. I've said this multiple times on the podcast. It's not an indictment against physicians and people that the men and the women that dedicated their lives to the profession, but the profession. Not the profession, but healthcare has really morphed into something quite different. And look, I am a freedom guy. I am a capitalist, and I make no bones about saying that I love capitalism. I think it's the bedrock of it's the foundational bedrock that this country was built on. The trouble that I have, though, kind of to your point, is profiteering off of someone else's um, misfortune is no way for a functional society to sustain itself. The market will correct; it will fix itself to an extent. But now we have healthcare systems, and you mentioned, and as I read through your book, so I have a very, very close family member that was in a position where her heart was beating. She was experiencing tachycardia. And so um, we went to a local cardiologist. They gave her a monitor to wear, and they were going to track this over, the course of a week or so. Well, before we made it through the course of a week or so, um, she had experienced like super tachycardia. She just taken a walk to a local grocery store. She felt like her heart was beating out of her chest, and so we took her to a hospital here on Long Island that's renowned as a heart hospital, and under the guise and the auspices of a charitable hospital, a nonprofit. We go in and they run some tests, ask a bunch of questions. She's not experiencing tachycardia while she's there. And they advise that she should have a cardiac ablation. They do an EP study. And so, knowing what I know, I made some phone calls, and it was really not, hindsight is 2020. So had I known better questions to ask, I would have asked better questions. But it was really more about the medical scores of the physician and the practice. And the medical scores were off the charts wonderful. And so, long story short, we go through with the EP study. They do a meet with the physician afterwards. He said, they noticed this anomaly, this electrical short circuit that shouldn't have been taking place. And so they ablate the tissue, which is they destroyed the tissue.
Yeah.
And she leaves the procedure and she goes in an amazing, vibrant, confident young woman, and comes out um, with someone who really had some anxiety issues. And so my whole thing is, why not, as a first step, before going through with an ablation, why not recommend magnesium, just a daily supplement, and let's see how that goes. And so the answer came when I saw the EOB and the fact that the hospital billed over $180,000 for that procedure. And then on top of it, if you add up all the other junk, it was close to a $200,000 bill. And if this is going on, Dr. Fine, and we know it is going on, why I mean, come on. Like that's just not cool. Not right. It is something that really must be stopped.